Hello and welcome back to Patient Knowledge. My name is Dr. Kirmani and this channel is all about health education. For my new viewers and subscribers, I would like to mention that every weekend I upload new videos related to various health topics. So if you don't want to miss out on that, do subscribe to my channel. Also like and share to as many people as possible so that we can spread the awareness. Today I will be talking about a brain disorder that affects the elderly. It's called dementia. The moment I talk about dementia, what comes into your mind is something to do with loss of memory. It's not only about that, there's a lot of other problems that occurs in dementia. So let's get started and find out about it. In this video, I will be talking about what's dementia, tell you about some of the symptoms, risks associated with it, what's the treatment, and will tell you how we can prevent it. At the end, I will give you a list of foods that boost the brain health and prevent dementia. So stay till the end. Now, what's dementia? It's a brain disorder where a person becomes confused, forgetful, and out of touch of the real world. Well, dementia is the third leading cause of death in the world. Around 20% of people over 80 years have a severe form of dementia. Well, each person experiences dementia differently, and it depends on the area of the brain affected. It's a chronic and progressive illness. Dementia is not a natural part of aging. Rather, the symptoms of dementia are caused by diseases that affect the brain. Dementia is a name given to various problems in the brain such as memory, thinking, problem solving, language, and perception. Well, it's caused by a loss of nerve cells. When a nerve cell dies, it cannot be replaced. As more and more cells die, the brain starts to shrink. A brain scan of a person with dementia shows there is shrinking of brain. It's rare under 65 years of age and it progresses slowly. Many times cause is not known. It can happen after brain damage from physical abuse, due to excessive alcohol consumption, drugs, and due to hardening of the arteries. Well, what are the symptoms? Loss of memory on a day-to-day basis. Concentrating. People have problem with planning and organizing. Will have difficulties with language, visual perception, will show a lot of changes in mood, will have apathy, confusion, and restlessness. Well, people with dementia will have a tendency to wander. They will have poor powers of reasoning and understanding with a loss of interest in previously enjoyable things. Will have some sleeping problems and show marked personality changes such as becoming more suspicious, irritable, withdrawn, humorless, and aggressive. A person with dementia will show marked emotional and physical instability. And it's sad and difficult for relatives to watch their loved ones develop aggressive and antisocial behavior, such as poor table manners, poor personal cleanliness, rudeness, and a lack of interest in others. Sometimes severe problems such as violent behavior and incontinence will eventuate. Now, are there any risks associated with it? Yes. It could be accidents with household items such as fire, gas, kitchen knives, and hot water, accidents at the toilet, in the bath, while crossing roads. People with dementia often neglect themselves, so they will have personal care neglect, and they eat poorly, neglect their bodies, will have certain medical problems such as skin ulcers, infections, malnutrition, and incontinence of urine or feces. If you suspect that a friend or relative has early dementia, take him or her to the doctor for assessment, and there is no cure, but some modern drugs may delay the progress of dementia to about 6 to 12 months. Ask your doctor about this. However, the best thing is to give them tender, loving care. Special attention will be given to visits from relatives, friends, general practitioners, district nurses, home help, minister of religion, and meals on wheels. Well, people with problems with memory and care will get a lot of help from special attention to memory aids such as organizing their lists, routines, medication, hygiene, diet, warmth, adequate nutrition, and vitamin supplements. Well, there are certain diseases that look like dementia, can be delirium, depression, or stroke. Delirium is a disease of the body that impairs normal function of the brain, and the causes are numerous. Can be severe infections, can be side effects of some medications, drug overdose, heart disease, liver disease following a surgery, or it can be due to a hospital stay. Well, it can occur quickly, can develop within hours or day, and is regarded as a medical emergency. The good news is it can be resolved with treatment. The other thing can be depression. Well, it can be confused with dementia, but the distinguishing features is cognitive impairment. People with dementia will have definite cognitive impairment, and this can be tested by using a screening tool, which is examining their mini mental state. Well, people with depression can be treated with antidepressants and strokes. Strokes are quite obvious and they can be treated easily with the medication. Now, how to prevent dementia? There's no doubt that there's no cure for dementia, but it can be prevented or delayed. So, isn't it a good news? You can do a lot to prevent it because the changes are happening much earlier in the brain, which can be prevented by lifestyle modifications, such as increased physical activity. Well, it's linked to good brain health. So, do at least 30 minutes of physical activities such as walking, aerobics, or any kind of exercises at least 3 to 5 days a week. Eat healthy food. Now, following a Mediterranean diet definitely helps prevent dementia. Eat more fish, vegetables, and high fiber grains. Red meat portions should be limited to 3 to 5 per month. People who smoke need to consider quitting smoking. Manage your weight through diet and exercise. Control your blood sugar level. And spend time with the family. Now, loneliness and decreased socializing are associated with higher rates of dementia. So, take out time and spend more and more time with your family and friends. And the last one is to keep your brain active, which is so essential. Well, there are certain activities that might be useful, such as playing board games, learning a new language, playing an instrument, or solving puzzles. This will keep your brain active and prevent dementia. Well, here's a list of foods that can boost brain health, such as almonds, blueberries, dark chocolates, broccoli, avocados, salmon, grass-fed beef, eggs, kale and spinach, and extra virgin olive oil. These are all good for your brain, so include them in your grocery list. Well, that's all for today. I hope this information was useful in understanding everything about dementia. Thank you for listening. If you wish to hear something about, leave it in the comment box below. Bye for now.